This is Dr. Abdul Rahman Hakeem. I'm a consultant transplant surgeon at Dr. Rela Institute and Medical Center. So before you have a pancreas transplant, patient have to go through a rigorous assessment. What we have to make sure is that there is not already a big damage to their heart or to their lung. So they go through what we call as a cardiovascular system assessment. So they will have multiple investigations. So basically, those who get a pancreas or a kidney transplant, or those who are extremely fit and have not already had a significant damage, or if they've already had a damage to the heart, for example, they've had a heart attack, if it's already been corrected and they're fit following that, then they can have a pancreas and a kidney transplant. Usually patients stay about 10 days to 14 days following the pancreas transplant in the hospital. The pancreas in fact starts working instantly as soon as it is transplanted within the operating theatre, and you have to constantly monitor them, make sure that there is no damage to the pancreatic graft that we implant by checking their blood sugar regularly in the first few days following the transplant. But once it all settles down, then the patient won't need a regular check of their blood sugar. And in terms of their kidney transplant as well, we make sure that their creatinine, the kidney function drops subsequently and it becomes normal. So the overall patient stay on an average about 10 to 14 days following the transplant. Complications wise, they can get things like bleeding after a pancreas transplant procedure, or an infection of the pancreas that we transplant. Any of these can be managed either with another operation, or it could be treated with things like antibiotics. So the other complications that can happen with pancreas transplant are things like what we call as inflammation of the pancreas that we transplant, what we call as pancreatitis. If that happens, you might either develop some collections around the pancreas, or it can lead to sort of high blood sugar for a short period of time. If that is there, then we can just treat it by giving some rest to the pancreas, or by draining the fluid collections that can form around. The other sort of complications that can happen are things like leakage from the small amount of bowel that we transplant along with pancreas. If that happens, then obviously I think this can again be treated with a drainage, or might need another operation. So following a pancreas and a kidney transplant, patient would need to be on immunosuppression medication, which actually reduces the immunity in the body. So these medications prevent the risk of rejection of the foreign organs that you've been transplanted with. So what we do is that start them on these medications initially at a higher dose in the first 3 months after the transplant, and subsequently the doses are reduced over a period of time. Because these medications reduces your immunity, there is also risk of that you might get either an infection, or over a period of time there are risk of developing small cancers like skin cancers, for which we monitor the patients over a prolonged period of time. In terms of follow-up, subsequent to their discharge, they will be seen in clinics twice every week initially, and then after a month they will be seen once every week, and then following sort of 3 months time they can be seen monthly after that.